This treatment video, I was actually assigned a device known as the Iowa Oral Performance Instrument, or IOPI for short. It was created over 20 years ago by a professor at the University of Iowa at the time, named Dr. Luche. And he intentionally created this device to objectively measure tongue strength for tongue elevation, lip compression strength, and endurance of the tongue and the lip. So I have a picture of the device in order to help us visualize it. And what you would do is you would take this portable device into the patient's room, for instance, and it measures pressure exerted on the blue air-filled bulb that you see on the screen. And all of the peak pressures are displayed in kilopascals on top of the digital screen that you see there. So this one's displaying 50. So I actually have a different picture that points out all of the different buttons to kind of help visualize that. So you can see the arrow pointing to the power button, and obviously you would first want to turn that on. And then let's say that you wanted to assess the tongue elevation strength. You would do that by finding the maximum amount of pressure that the tongue could press against the palate. So you would place the bulb inside the patient's mouth, and then you would want to press the peak mode button that you can see right there. And what it would do is the IOPI would measure the tongue strength that you're exerting on the bulb. So one way that they explain this is if you are sucking your thumb, so that top part is going to be touching your hard or soft palate, depending on if you want to assess anterior or posterior tongue strength. And then, for instance, in that illustration, your nail would be the bulb in that case. That would be assessing the amount of pressure that you're exerting. And you don't have to maintain the pressure for an extensive amount of time. It says that it can take a reading in about 2 seconds. But they provide users with standardized measures. And in order to be able to use those, you're supposed to take at least a series of 3 measures of pressure, and then you want to take the highest one. And it requires that you give patients a little bit of lag time, if you will, in between measures. So you would want to wait at least a few seconds in between different measures. And another really helpful feature of the IOPI device, I'll bring the picture back up, if I can get it centered on the screen, is the biofeedback component and the ability to test tongue endurance. So there's a timer, it says show timer, you can see that, and then show lights, and then the green light, and then the red light array. So what this would be used for instance, is let's say that you wanted to assess how long the person could maintain tongue endurance. So you would go up here to where these arrows are, and you would want to set the pressure to a specific amount relative to the patient. So they would recommend a pressure that's about 50% of their maximum pressure. And so what you would want to do is then you would place the bulb in their mouth, you've set the max pressure, and when they would then begin to exert the pressure, it would light up the lights on this side of the screen, and you would want to see how long can they maintain that green light on. And when their pressure would decrease, these lights would change back down to the red. And this gets us into the biofeedback component of the device, which is the lights on the side. And this is really helpful for patients because it provides them immediate feedback on different exercises that you may be working on. So they would immediately know, am I reaching the pressure that I'm supposed to be, or am I not? And it doesn't leave much room for questioning since it's an objective measure. So this is useful to us in dysphagia treatment because research has shown that tongue exercises really do have an impact on the swallowing process. And the IOPI specifically allows clinicians to give very objective feedback and measurements, and it allows us to discern if the patient's experiencing true weakness or a lack of oral motor control. For the evidence-based portion of the project, I've uploaded 3 full text articles to Moodle. The first one's a systematic review that really just validates the use of the IOPI as an instrument for measuring tongue strength and tongue endurance. The second's a really interesting article by Allie Mayer, and what she did was study the use of IOPI in patients in the outpatient setting. So they were working on strengthening exercises 2 to 3 times a week for 45 minutes. And what she found was really amazing. So she saw that the patients achieved functional gains through restored muscle function based on these exercises. In fact, she found that from initiation to patient discharge, patients saw a 71% increase in lingual strength at the anterior position, a 61% increase at the posterior position, and then a 314% increase at the base of the tongue, which are huge gains. In this last article, 3 researchers used the IOPI device as a biofeedback in a study where participants performed pressure training through isometric strength exercises for the tongue and pressure accuracy tests. And what they found was also really interesting. They saw an increase in isometric tongue strength, improved tongue pressure generation accuracy in patients, improved bolus control on follow-up FEES evaluations, and improved dietary intake by mouth. So clearly the IOPI is a really helpful resource to have in our tool bag as we go into different sites and treat dysphagia. And if you have any questions, please feel free to ask.